starting? Yes. Do I have my list of people here?
Okay.
Okay, why don't you start?
How you doing, sir?
Good to see you.
Thank you. This is Cliff Moses, my vice chairman.
Gotcha. I'd like to note that only the chairman and vice chairman are the only two people in ties today.
Because of our distinguished guest. So, I would like to welcome Senate Majority Leader Chuck Schumer once again to Madison County. Senator Schumer has served the people of New York State as a member of the United States Senate since 1998. He became New York's senior senator when Senator Daniel Patrick Moynihan retired in 2000. Senator Schumer kicked off his first Senate term by announcing he would visit each of New York's 62 counties every year, a tradition he continues today to keep in touch with voters from every corner of our state. Throughout his time in the Senate, Chuck has been improving New York's economy, his top priority, bringing affordable air service like JetBlue to upstate New York. He has worked to successfully retain New York jobs that were at risk of leaving and attract many New York firms to New York and create many thousands of family supporting new jobs. He has delivered countless large and small victories across the state, including delivering $20 billion to rebuild after 9/11 terror attacks and passing a $63 billion relief package to help New York recover from Superstorm Sandy. From massive snowstorms in western New York to numerous floods across upstate, including here, Senator Schumer has been there to deliver aid and support New Yorkers in a time of need. This is another time of need for our community. Welcome, Senator Schumer. We are grateful the Senator is recognizing mental health as a crisis that needs attention here in upstate New York. This is why we have put together our mental health task force here in Madison County. Senator, we'll turn it over to you, sir.
Thank you, Mr. Chairman. Well, thank you, and I really want to thank Chairman Becker. We have had a great... Go ahead, folks. You can bring up your little things.
You know, our wireless died, and we want to hear you, so...
Yes.
Whoops. See? This is why you don't do this when you're standing here. I do it before.
There it is.
There we go.
Yeah,
Thank you,
maybe if you put this way, it'll push it back.
I don't want to cover your nice logo.
Thank you. Okay, so I want to thank John Becker. We have had a long and close relationship for a very long time, helping Madison County in numerous ways. We just got quite a bit of money to go directly to Madison County. I'll talk about that at the end. In addition, and another reason I'm proud to be here is because Madison County is taking a lead on mental health issues, which have skyrocketed during COVID. And I thank everyone here for doing that. I want to thank our Mark Simone, our county administrator. I want to thank our vice chair, Cliff Moses. Thank you, Cliff, for being here. Tisha Cook, who's the director of mental health here in Madison County. Mike Fitzgerald from the Social Services Commissioner. Dan DeGeer from Emergency Management. Samantha Field, Public Information. And we have Eric Feist, Madison County Public Health, and Mike Kevel, the Madison County Clerk. So thank you all, and many of you, how many of you work for the county? Raise your hands. Thank you for the good work you have done across the board. Thank you everybody. Okay, now, why are we here today? Well, we're here to talk about a problem. Thank you. Yeah, that's good. I don't want to ruin Channel 9's thing.
I'll take it.
Thank you. Okay, so we're here to talk about really what's been a hidden crisis, one that's affected hundreds of our neighbors right here in Madison County, throughout central New York, and it's gone largely undiscussed and unaddressed with so many other problems that are so prominent with COVID. And I'm talking about the mental health pandemic, which is silently spreading adjacent to the COVID pandemic. Too many of our neighbors suffer in silence and need more support from local mental health providers than ever before. So that's why I'm here today to announce that as part of the American Rescue Plan, that there are several new programs I fought for and secured as Majority Leader to provide record funding to ramp up mental health resources here in Madison County and across central New York. And that plan focuses on getting money to providers so they can begin the important work of expanding their networks. This is both for mental health and for addiction, because addiction has also increased greatly during the COVID crisis. People have many, many problems, and when people have problems, especially so unusual as COVID, both there's increase in mental health and there's an increase in addiction. And we shouldn't just shrug our shoulders and say, well, that's how life is. We can help people become productive, working, happy citizens once again, and that makes all of us better. So that's what we're trying to do. So what's in the battle plan to combat mental health? The answer is there's $5 billion in relief in the American Rescue Plan, more than has ever been put before for both mental health and substance abuse. It's a record. But before these dollars can go out to places in central New York and Madison County that need the help, both the federal government and HHS and the state government have to stand up these programs ASAP. And I am here asking both the feds and the state to get moving quickly because the funds are very much needed. Central New York's mental health providers should be among the first in line, given that the region has been hard hit, and this region, personified by Chairman Becker and all of the folks who are here, is really jumping to the front of the line in terms of helping and setting up a structure to deal with the issue. So let me, it's going to be $5 billion, and it will do lots of things. It combats substance abuse. It addresses mental health needs, particularly of our healthcare professionals. A lot of people who had to deal with COVID close up ran into problems. It addresses youth mental health and helps out first responders as well. Here's specifically what's in the plan. But you know, before I do that, I want to give you some other numbers which I found astounding. Here in Madison County, and it's very good. You can't solve the problem until you know the extent of it. Between 2019 and 2020, there's been a 250% increase in the number of mental health-related crisis calls to the Madison County Health Department. They got 192 calls in 2019. That was a typical pre-COVID year. They got 485 calls in 2020. Now it's only May, and they've gotten 614 calls already, more than all of last year. So this shows you this is a problem. Here is how we deal with it. I secured $3 billion for two critically important federal block grant programs. $1.5 billion for community mental health services, that's mental health. $1.5 billion for substance abuse. That's the largest amount of money. New York State got the money a few weeks ago. And so now both county government and local providers who help people with substance abuse and mental health addiction can apply and deal with the overload of people who are calling them up. So that's why we've got to do it. In addition to those two big block grants, basically, they're not quite block grants. Their money's, it goes to the state. The state can't spend it on itself. It has to give it to the providers who apply. Substance abuse and mental health. Then there's separately a $1 billion federal program to provide mobile crisis intervention teams. Madison County can apply for those, and if they do, and any county in central New York, I'll push hard to see that they get them. And those are sort of vans that go around and meet the people. A lot of people don't want to admit they have mental health problems. A lot of people don't want to admit they have substance abuse problems. We have all known that. We know people, their family, friends who have been through this through the years, and you know the heartbreak. I do personally from friends. When they have these mobile centers that come right, you just got to go outside your door, and it's beautiful, and they're very well appointed, and you can sit there and talk to someone and get the help you need. It brings people out. So there's $1 billion for that the county can apply for. There's also $420 million for certified community behavioral health clinics. These are certified special health clinics. The feds are giving money. We've gotten them a total of $1 billion. $600 million in December, $420 now. Now, there's none in Madison County, but there are two in Syracuse that serve Madison County residents. One is called Helios. What's the other one called, Joe? Liberty Resources and Helios in Syracuse will apply directly to the feds for this money and can expand, and that will help people here. There's also $140 million to help frontline workers. Again, the county can apply for that and say, well, we have some people who worked in the hospitals, worked in the ambulances, worked in the clinics to get that help. $140 million for young people to prevent youth suicide and the trauma for young people. Again, the county can apply for that. And $30 million for community-based harm reduction programs. So here's what we need. We need HHS for these programs and the state for the two big programs I mentioned to get the funds out the door. Let's get moving. That's our point here. Let's get moving. These funds are desperately needed. You can see those astounding numbers in Madison County. Okay? It's estimated that during the pandemic, listen to this, 4 in 10 adults have reported symptoms of anxiety or depression, up from 1 in 10 who supported that a year ago. So that's the extent. The bottom line, these numbers indicate the mental health crisis is going to last after we beat COVID as a physical disease. So we got to keep at it, and that's what we're trying to do here. I worked very hard to get these funds in, and now we want to see them distributed. The funds on the shelf in Washington or in Albany do no good. The funds here in Madison County, in central New York, and at all of our clinics is where we need them, and that's what we want to do. So with that, now I'm going to screw things up here. Who's the next speaker? You took away my sheet. Tisha. Do you want to speak? Chairman and Tisha. Go ahead. Oh, wait, I wanted to say how much money we got Madison County. Last page. Thank you, Joe. See, okay. In addition, I haven't been in Madison County since we passed the ARP, so I just want to remind all of you all the other types of help that we were able to get. As Chairman Becker knows, the state wanted all the money for itself. I said, we're going to give some of the money to the states, but some money directly to the counties. And so right now, Madison County, there'll be more than $20 million for our local governments in Madison County. That's money they can use for a whole variety of different things. $13 million for the county, $1.1 million for the city of Oneida, $6 million more for the towns and villages. In addition, our colleges got money. SUNY Morrisville got $10.4 million. Colgate got $4.2 million. Cazenovia College got $2.8 million. The schools got hundreds of millions of dollars as well, so they can open fully and create summer school, which is needed for all the kids who lost time. That goes directly to the school boards and lots of other things that they have money for New York, but they didn't break it down into the county, so I won't go over all of that. Chairman Becker.
Thank you. Thank you, Senator. I'd like to thank those on the task force, Cliff Moses, my vice chairman, Mark Simone, the county administrator, Tisha Cook, our public health director, our public health director, Eric Feist, our emergency services director, Dan DeGear, our Department of Social Services, Mike Fitzgerald, and our consultant, Matthew Rosa. We put together this task force because of mostly the pandemic and post-pandemic issues and issues in our society today. As the senator said, it isn't only substance abuse, the mental health issues of kids not going to school, both on the parents and the kids with remote learning. It's the economy, small businesses, people that are struggling with their small businesses, employment, those kind of things. And we want to take a good cross-section of all that and take some time and look at how all of those things affect our society and our community here in Madison County. We're a very close community here in Madison County. We have a lot of friends. We're very close, and we want to see things, see our neighbors do well and stay healthy. You know, we put a great emphasis on a great physically fit body, but if your mind isn't right, you've got problems. And we're here to help people with their minds and feel better and get over their issues and get on with their life. We see many times with a lot of our veterans that come home from overseas and everything that they just want to end their lives, and that's, you know, there's a lot more to life than just ending it There's people that care about you, family, community, and how can you contribute to society than just, doing away with yourself. And we want to look at those things, and we want to help people in many ways, and we've recognized that here in Madison County. And I've talked enough, so I'm going to turn it over to Tisha and let her talk. So.
Tisha, you're on.
Okay.
Don't be nervous. Come on.
Thank you very much, Senator Schumer, for coming today. And I just want to thank everyone for coming out. It's very exciting that the focus is being put on mental health as we move into the recovery phase of our community and the state. And so we're really looking forward to doing a very comprehensive needs assessment and figuring out what exactly the county needs as we go forward. And so we have a great team, and as Chairman Becker said, we have a great partnership among the community members and our county, and so we're looking forward to getting to work and helping sort out what everyone needs. So thank you, everyone, for coming today.
Thank you, Tisha. Good job. Joe, anyone else scheduled to speak? Anyone else want to say anything? All right, then we'll do Q&A. First on this subject. Yes, that's your little mic. I did not do that.
Gravity.
Channel 9 did it. No, they didn't. We don't want to have internecine warfare among the media.
There we go. All
Thank
right.
you. Okay, this subject first. To any of us.
FMAP. You want to talk about FMAP?
FMAP? Go ahead.
The state. What do they do? Keep some of our FMAP.
They're taking away a lot of our FMAP that you got us. You worked so hard to get us.
So we worked on.
I'll work on that. Okay, good. That's FMAP. I got him a lot of money in FMAP. The state's trying to take it away. Story of life for a county. Okay, other subjects since we finished this one. Yes.
I was pleased to hear about your mobile units. Do you know more about how they'll be manned?
Yeah, the federal government will pay for manning them too, or peopling them, or whatever the right word is.
What about the credentials of the people?
It'll be, they're writing up a whole bunch of criteria. Now, certain of the mental health providing institutions have people who are qualified. So, but the federal government will pay for all of that.
What triggers the mobile unit going out?
Well, they'll submit a plan. The county or the county providers will submit a plan. The federal government will approve it, and then they'll have to follow through on that plan.
Tisha can answer that.
Tisha.
Hi. So
Hi.
currently in Madison County, we have a mobile crisis team. Liberty Resources actually operates a regional mobile crisis team, so we already have that established. I'm assuming this is kind of to enhance that, which is very exciting, and obviously we'll look at it. But right now, people can call our main line, which is 315-366-2327, and you'll get one of our licensed clinicians who assess the situation, and if we need to dispatch mobile crisis, we do so, and they come right to the person's home.
They're all there.
I didn't do any of that.
So is the person in crisis or a family member they call?
Any of
Yes.
it. Yep.
Yes.
Yep.
Is it 24 hours a day?
Yes, during the daytime, it's our clinic, and then after 5, it is mobile crisis.
But they could expand under this program and have mobile crisis units that are available 24/7.
Senator Schumer, you spoke to the graduates of Lemoyne, I believe, on Friday. You mentioned to them your push to relieve some student debt.
Yes.
Where that stands with the president, is that something he can do by executive order? And if not, will Senate Democrats or congressional Democrats push for it?
Okay, to answer your second question first, yes, he can do it by executive order. And where it stands is we are trying across the country, I couldn't say this at the graduation, but we are trying to get 15 million emails, calls, letters to the president to do this. College should be a ladder up, and that's how it's always been. But with student debt, it's often an anchor down. So many kids have so much debt, and middle-class people too. So the president, you don't need legislation. With the flick of a pen, can just say $50,000 of debt is forgiven, totally. And you don't pay taxes on it. We passed in the ARP because he said, well, I don't know if I should do this, because let's say you get $20,000 in debt forgiven and you're paying 25% rate taxes, you'd have to pay $5,000 of that. Now that doesn't have to be done either. So we are trying to get this done because it's a lot easier to get it done by the president doing it on his own. If not, we would look at legislation.
Where would the money come from if he signed it via executive order?
It would come, it's part of the same place where ARP and other places came from. He could decide to do it by increasing revenues. He's proposed to undo some of the taxes on the very wealthy people. Or we could just say this stimulates the economy during a time of crisis and we're pumping money in. Anytime a student doesn't have to pay $300 a month or $500 a month in debt, and they spend it in the local stores, at the restaurants, and everything else, it pumps up our local economy.
Do you encourage Central New Yorkers to take part in your 50?
Yes, I encourage not only the students, but their parents and grandparents. And by the way, if a parent took over the debt from the student, which some parents have done, it applies to them too. And we have people 40, 50 years old who still owe this debt. Okay, yes.
When could we possibly expect the ARP money, and if the president does sign by executive order for the student loans, will that be additional money or will it be part of the original?
No, it would be, the president's signing would be additional. The ARP money, it's starting to get distributed already. Did you get any of your county money?
Yes, last week.
They got their 13 million.
Yeah.
Nothing,
The towns haven't received it.
town will receive it. They have to work.
Portal's
The
not
state-
open, waiting for
The
the
state will set up, because you see, why didn't we give it? We gave it directly to the counties, directly to the cities. That's why I could mention Oneida.
No, I'm glad. That's a good idea.
Yeah, but we couldn't give it directly to the towns because each of the states has a different structure. So you couldn't write it for 50. Some people have towns, some people have townships, some people don't have villages. So we have a formula they have to go by, but it's got to go through the state and the county, which they will get the money, and then they will have to distribute it on the formula to the villages and the towns. Yeah.
When the January 6th commission voted down, what would you like to see happens next for
Well,
investigating that?
first I would hope that maybe, we have 6 Republicans, we need 10, maybe 4 more will join us. We don't know, but if not, we have to get to the bottom of this. This was I was within 30 feet of these insurrectionist, horrible people. And we have to get to the bottom of it, so we'll have to set up something else if we can't get it done in a bipartisan way. The best way is like the 9/11 Commission, bipartisan. That's what we had set up. It was 50% Democrats, 50% Republicans, only subpoena power if both agreed, witnesses, staff, both agreed. So hopefully maybe over the break or later, more Republicans will join us. But if not, going to find another way, an independent commission. A commission will be set up, but it won't be as bipartisan. Yes. Hey, you weren't first this time. Oh. No wonder your microphones are so close to each other. Yeah, it would have to be worked concurrently. It would have to pass both houses and be signed by the president.
You've been such an advocate for restaurants, but so many say that they're having a hard time finding people. They have the money, they have the business coming back.
Yep.
A lot of them blame the unemployment benefit.
Yep.
What would you say to the
There are 4 or 5 reasons people aren't coming back. Some is because of unemployment. Some is because a lot of people, restaurant work is grueling work and doesn't pay much. And when they had to stay home, they said, I'm going to take up nursing. I'm going to start a small business. So a lot of people don't want to go back. Then there's a third group who are still scared to go back in COVID. I don't think they should be scared because so many people have gotten the injections, but there are. And then, so that's third. Fourth, you used to have child care issues. You still don't have all the kids going to school. So that means the parent can't go to work. And the fifth is, frankly, immigrants. In a lot of places, immigrants work in these restaurants, and they've been greatly cut back on. So there's a whole bunch of reasons.
But to the people that say it's the unemployment is the main cause, how would you defend the benefits that have been given out?
Well, it's probably that, in the study of the Federal Reserve, that was fifth after all these others. And then it benefits a lot of people as well who can't get back to work. They need help. We want to get the economy moving again. And so far, if you look at the numbers, this money we are pumping into the economy in different ways is helping. That's one of the reasons we help the counties in the states. If they were to lay off in the 2008 recession, the number one reason the economy took 5 years to get back, we didn't help out the state and local governments, and there were millions of people who were unemployed. We want to get people working, and we want to get people making good salaries, and we want to get the economy growing the way it used to go. Growing the way it used to grow when Rocky DeVeronica was a kid.
Madison County did not lay off a single person last year during the pandemic or furlough anybody.
There you go. Hear, hear. In 2008, there were a lot of layoffs. That was before Becker was chairman. Okay, thank you, everybody. Have a nice day.